All right, everybody, welcome to a scientific deep dive of bone remodeling specifically for martial artists. For those of you who are not new and you've been here before, welcome back. For those of you who are, I'm Patrick Jacobs. I'm a physical therapist. I have a doctorate of physical therapy. Very fancy. Not really. What is fancy is I have a doctor of brolosophy, which uniquely qualifies me to talk about these things because even though we fly in the face of bro science here, we still like to consider ourselves bros. You know what I'm saying? So, if any other YouTuber tries to claim that they're better, just say, bro, do you have a doctor of brolosophy? And if they don't, just keep coming back to this channel. Enough said. Our agenda. We're going to talk about mechanostat theory. This is going to be the foundation of the whole presentation. It's really just an improvement upon Wolff's Law. Most of us have heard this, but we'll get in more detail with that later. Then we'll go over the anatomy and biomechanics of both the upper quarter and the lower quarter, which is important to understand whenever we want to learn how forces are distributed through different parts of our body, and then how we can apply them in our training to make us better. Mechanostat theory. Dose-response continuum of strain magnitude to explain mechanisms of bone remodeling. A very mechanical-based theory, okay? This is meant to replace or expound, I guess we'll say improve Wolff's Law, and just a little bit of a kind of an educational moment about science. Something like, whenever we say theory, we're talking about things that are well accepted within that field. Okay, the scientific consensus is very strong. So the universal theory of gravitation, most people think that gravity is a law. Gravity is actually a theory to explain the law that if I drop something, it'll accelerate towards the center of the earth at 9.82 meters per second squared. We know that it doesn't explain very small subatomic particle movements, and we know that it doesn't explain planetary movements whenever it comes to more than 2 planets. But it does a very good job within our environment explaining these things. So the same way that Einstein's relativity and oh gosh, what am I thinking here? Oh, space and time and relativity is trying to expound upon Newton's universal theory of gravitation. Mechanostat theory is trying to build upon Wolff's Law, or the theory of Wolff's Law. So one of the weaknesses, though, that it actually relies really heavily on just the mechanical portion of bone remodeling, or the things that can actually factor into the mechanical portions of bone remodeling. It doesn't take into consideration things like hormone fluctuations, potentially blood flow, and maybe physiological disease that we definitely need to take into consideration in a full human model. But this is a model that we'll be using to justify how we train. The 4 main things that it talks about in this really big article, from which I got all of the following articles in the citation. At the end of this presentation, I'll just go ahead and mention it now. There's several pages of citation, or 2 pages of citations. The last one will be that really big article from which I got all the others. So it talks about strain magnitude, strain rate, frequency, and strain distribution. We're going to be talking mainly about strain magnitude and strain distribution, particularly when we're talking about punching. But typically what it says is that the bone cells that are local to the actual force, meaning your shin when you're kicking something, or your arm when you're punching something. So this means that there's no systemic benefit, really. Like if you punch a bag, your left toe is not going to increase in bone mineral density. They locally respond, and they optimally respond to the net effect of loading that's dominated by high strains. Remember this, high strains changing at fast rates, presenting an unusual and unbalanced distributions. If that's not combat sports, I don't know what is. I mean, we're kicking each other, we're suplexing each other, we're punching each other everywhere in varying different angles. There's an infinite amount of possibilities. So this is why I think mechanostat theory can help us. It's well accepted in the literature, and even though there are weaknesses like there are to every other theory in science, trying to explain physical laws, I think we can take this and build our foundation for why we should include some sort of kicking and punching to the bag to increase our bone mineral density. So this is a graph representation of mechanostat theory. So what I want you guys to see is, we'll start at the top left. You can see the DW, that stands for disuse window, and all of this stuff is kind of explained down in the figure 3. where it explains what some of the literature means in the actual graph. So we want to stay at the front anywhere from, and I'll go ahead and throw this up, anywhere from the left end of the adaptive window, okay, and then about halfway to 3/4 of the way to the mild overload window. And the reason I did that is because we don't even want to start approaching, we don't want to do enough to approach the pathological overload window. And you'll see where these lines that delineate between AW, MOW, and POW actually correlate down at the bottom with MESR, MESM. And so what these mean, if you read down at the key down at the bottom, MES just stands for minimum effective strain, and R stands for remodeling. So we know we want to do enough to stimulate bone remodeling. M stands for modeling, and we don't want to do enough to get to MESP, which is the micro damage. So the reason I kind of drew that line, it's really an arbitrary line. You could kind of push it all the way to the P if you want to, but this area here, you are safe. As long as you give yourself time to recover, you can train within these windows, and you see how the graph kind of levels out. We don't want to have this thing where we think we're getting better and there's this ceiling, you get through this diminishing return, and all of a sudden we're in the pathological overload window, and that's when we start to form these actual microfractures, or, excuse me, sorry about that, or stress fractures, sorry. So let's move on. You can pause and look at that all you want to. If you have any questions, just let me know in the comments and I'll do my best to answer them. So the way this is going to work is I'm going to just kind of show you a slide, explain kind of briefly what the actual anatomy of the different areas are, and then I will cut away and actually do an anatomical, like I'll take you through the computer program that I have, the Human Anatomy Atlas app, and we'll look at kind of like a 3D image. So the metacarpals are the long bones. At the top of those bones are where your knuckles are. So the metacarpals, even though they're long bones, it just has to do with their shape. The end of the metacarpals are your knuckles. Carpal bones are the bones that articulate with the metacarpals and the radius and ulna to kind of form the wrist complex. And then you have the radius and ulna of your forearm, the humerus of your upper arm, and then the scapula. And then we'll take a look at the ligaments, because I think the ligaments are, I want you to see the vast array of ligaments that are in the hand, because I don't know that people really understand how much ligaments play a role here. All right, so let's look at the actual anatomy. All right, so here we've got the Human Anatomy Atlas app pulled up, and we're going to swing it around so we're looking at the back of the left hand, because I think this is the best view. So the first bullet point was metacarpals, and so these are these long bones that we talked about. They, at the top of these bones where I've got my cursor kind of hovering around, these will be the knuckles that we're punching with, okay? First, second, third, fourth, and then the thumb. What I really wanted you guys to see, and this is a really vast array or vast network of ligaments that a lot of people don't really understand exist in the wrist and hand. So whenever we're wrapping our wrist, we're essentially trying to prevent the spreading of the carpal bones from one another, but we are really taking some of the pressure off of these ligaments. Ligaments respond well to these quick force distributions like bones do, and tendons as well. So whenever you're wrapping your wrist, you're essentially taking some of the burden off of these, either the carpo-metacarpal ligaments or carpo-carpal ligaments, intercarpal ligaments, things like that. So I'm just going to remove some of this. Retinaculum here, it's not important. So we can see the first and second rows and where they act of the carpal bones and how they actually articulate with the radius and the ulna. So this would be the second row, right, because it's the most distal, and this would be the first row that make our wrist and hand complex when it articulates with the radius and the ulna. As we zoom out and come a little bit more superior, we can see the radius and the ulna, right? So you know it's the ulna because it actually comes and articulates with the humerus here to form the olecranon, that pointy part of the bone, and then the radius. And then we will come up and look at the humerus, that big long bone in the upper arm, and then it articulates with the scapula to make the scapulohumeral joint. These were all worked together to punch, but we're actually going to go through this one by one and look at how the digits flex. So essentially when we're making a fist here, this is actually extension. Whoops, I want you to look at flexion. Yeah, so when we flex, I'm going to pause it right there. We can see these long bones are the ones that we're punching with. Okay, so that's where the force distribution is going to start down the chain. Okay, we'll let you look at that one more time. When we're making that fist, to pretend like the thumb is tucking in. Boom, pause right there. Second metacarpal, third metacarpal, because this one's the first, right? But this is that first knuckle that we talk about. We want to punch with these two, right? So now I want you to see how the carpal bones actually move on one another. So if we swing around, we're looking at wrist flexion, or I really don't know another word for that. Wrist flexion is all it is. So what I really like about this view is you can see the carpal bones moving along one another as it moves up. And I'm going to pause it right there. So we got the second row of carpal bones, the first row of carpal bones as they articulate with the radius and the ulna. I'll let it play through one more time. And so this shows that if the varying amounts of wrist flexion and finger flexion, depending on how we're making a fist and what we're hitting at the time, can dictate how the forces are distributed through our arms. Then the last one I want to see is something that would resemble a hook. This is about as good as I can get to actual punch being thrown. So if we look back, yeah, this is a good way to look at it. So I want you to notice the actual scapula. So the scapula is protracting, or in this case we'll call it a lateral glide, because it's not actually elevating like it would in protraction. But you can see how the scapula and the humerus are heavily involved in punching, right? You can't punch without it. You really can't punch without a good rotation of the thorax, but again, or the thoracic spine. But again, we're kind of limited in this software that we have here. But this is still a really good way to see that if you, like, let's say that this fist was balled up and it ended right there, it punched, that this force would likely be distributed more laterally or to the outside. But if it were to actually, like a jab, let's pretend like this arm came straight out and you were punching something straight out in front of it, it could be almost a compressive force directly all the way through the radius and the ulna, the humerus, and into the scapula. So this is something that you have to take into consideration. It's a lot different than whenever you're kicking, because kicking, your force is going to be pretty much distributed to that lower third of the tibial shaft, which we'll get to later. All right, so now that we've seen the anatomy and biomechanics of the upper quarter, we're going to go down to the lower quarter. Shin anatomy and it's kind of funny to say Shin biomechanics, because the shin doesn't actually move. It doesn't have like a joint articulation. It articulates superiorly with the femur. The tibia and the fibula create the shin, and then it articulates with the talus down at the ankle. All right, so let's get into the biomechanics and the anatomy of the shin, knee, ankle complex. All right, and now we have the Human Anatomy Atlas app pulled up, and we are going to look at the shin. Okay, so this is the main bone of the shin, the tibia. We're focusing, anybody who's ever kicked enough in their life knows that you're trying to use this bottom third of the shaft of the tibia to use that as a weapon. All right, the other one is the fibula. It's about 90% non-weight bearing. The tibia takes the brunt of that. And then you've got, obviously, its articulation down here with the talus, creating the ankle mortise. And then superiorly, if we zoom out, it articulates with the femur, creating the tibiofibular joint and the knee joint. So, but these biomechanics are a little bit easier to understand. There's nothing really resembling a kick in this software, but if we zoom in to the part where it's supposed to be used, we know that it's this really nice long shaft. That's what she said. And we're using the bottom third, or the inferior third of the shaft, and the anterior shaft of the tibia. So I think it's important to know this, because there's really nothing else around here that takes the force, that distributes to where they could distribute the force. Because we're kicking, it's going to be a bending force placed on the tibia, and it's pretty much only going to be absorbed by the tibia unless you miss kick and you hit where down here. We know that's very painful. So I think it pays to see this anatomy and understand the relationship between the two joints, between the tibiofibular joint and the talar crural joint and really visualize the portion that is going to be doing most of the absorption most of the absorbing of the kick. So that is not really biomechanical, but that's the anatomy of the shin. All right, so now we've got a little bit of an understanding, at least basic understanding, of the upper quarter biomechanics that we might expect to see when we're throwing a punch, at least a general model. And then we've looked at the anatomy and biomechanics of the shin, or the shin, knee, ankle complex. Let's talk about what we should be prioritizing and how we should train. So you should definitely, the literature is very strong on this, and I responded to Armchair Violence's video whenever I was criticizing his video a little bit only because after I made the first shin conditioning video, it was linked to me, so I went and watched it. Then I responded to him because he thinks it's bro science, and I laid out several different reasons why I didn't think it was. And part of the things that we agree on, the first one, is that you should be prioritizing weight training. The evidence is overwhelming. You should be lifting weights. You should be doing lower body exercises if you want to. If you're not doing it already, you should be lifting weights, not skipping leg day, essentially. Kicking the heavy bag is only going to come whenever you have established something like that for a couple of months, because you will make incredible gains with respect to your bone mineral density and how strong your bones actually feel whenever you're kicking something if you lift weights. Kicking the heavy bag is icing on top. I think it can really, really help. And I don't know that anybody would really disagree with that who's done martial arts for a long time. You can just feel something is different whenever somebody who's been kicking for a long time kicks you, and then somebody who's got these soft bones kicks you. It could be a coordination issue, it could be a power issue, but I think people can really feel what it's like to have somebody who's got actual conditioned bones. These should be really quick and powerful sessions, and I'm talking like maybe even less than 20 kicks. So I actually cited this study, and it's a really cool study. So it's a study that they did in Japan. It was adolescent girls, I think they were less than 16 years old. 3 times a week, they had them jump as high as they could 6 times in a row, one day. So on Monday, they jumped as high as they could 6 times in a row, skipped Tuesday, jumped as high as they could 6 days in a row, skipped Thursday, did Friday, something like that. The control group didn't do any of that, and they measured their bone mineral density over, I should remember this. Maybe it was a couple months, maybe it was a couple weeks, I can't remember. There was a significant difference in the bone mineral density changes in these girls. Now, some of the weaknesses of this study is that they're actually laying down a lot of their skeletal skeletal tissue since they're adolescents, right? We know that you lay down a lot of your bone before you're 30. Not to say that you can't remodel and actually make your bone mineral density higher after 30. It's just a lot harder. So you could say that played a role, but then the control group, it was still statistically significant. The control group was the same age, right? So this suggests that it really doesn't take a whole lot from a minimum. If you've listened to Renaissance periodization, right, you've got the minimum adaptive volume. Less than 20 kicks. If you go, let's say you're doing jiu-jitsu one day and you're like, all right, I'm about to start incorporating some kicks to the heavy bag because I want to increase my bone mineral density, specifically for combat sport, martial arts. You go in, you kick the heavy bag really hard for, let's say, 3 to 5 minutes. 20, really get into it, really turn your hips over, really turn your shoulder into it, focus on technique, but really kick as hard as you can. And then you go and do jiu-jitsu. According to what we have, there is a scientific precedent that suggests that you have done enough to stimulate bone remodeling in your shin for that day. So take that in consideration. And if you have any questions about how to work this in, I talk to people all the time on Zoom about this. We can hop on and talk about it. But this is something that I've found effective. If you've got a grappling day, you can get some bag work in that really just kind of helps you warm up. You can stimulate that bone remodeling in the shin, and then you can go work on your grappling, whatever you're working on with your ground game. Okay, now let's move the training application to your wrist and hand. This is obviously a little bit more, I wouldn't say nuanced. It's a little more complicated though, because as we learned, we've got the carpal bones, we've got all those intercarpal ligaments. We've got the different force distributions for if we're throwing a hook versus if we're throwing an uppercut versus an overhand. So it really, the same thing applies. The first bullet applies. You should be lifting weights. Okay, you should be doing pressing movements, should be doing pulling movements, should be mixing up, like I say at the bottom here, closed and open chain movements like push-ups versus like bicep curls or whatever. And gloves should probably be used to distribute forces, because remember, these have to be punches. They need to be high strain magnitude with changing at fast rates, with unbalanced and unusual distributions. Okay, so this is punching. So you need to be punching as hard as you can if you want to stimulate the maximum amount of growth for the shortest amount of time. And we know that bones adapt to their mechanical environment that we put them in. So if we're not punching as hard as we can, we're doing ourselves a disservice. That's why I think you should wear gloves, because it reduces your risk for injury. If you're punching the heavy bag with your hand, you catch it one wrong way. I think this is, in my original knuckle conditioning video, I think it's Hard to Hurt's YouTube, Hard to Hurt Mike from Hard to Hurt. He does a video on knuckle conditioning, and he talks about how whenever you're punching with bare knuckle, you should be kind of working on timing and technique, and it actually helps condition your skin and your nervous system. But if you really want to maximize bone mineral density, the force is distributed all the way through your upper arm. Obviously, these are going to, the metacarpals and the carpal bones that we talked about are going to get a lot of the initial distribution, but we want it to be distributed through the arm in a way that's not going to risk injury. So wearing gloves, I think, is a better option here. And again, these need to be hard, they need to be quick, and they need to be powerful. It's literally as hard as you can. Now, I'm not saying go and wail like you see people who've never fought before fighting the street fighters, right? Throwing these wild punches and not really knowing what they're doing. Be targeted, be intentional, but it needs to be very, very powerful. Okay, so if you have any questions about that, just let me know. I'm going to go ahead and go into the citations here, so you can pause them if you want to actually look up some of this stuff. And oh crap! All right, I didn't add the final, the thing that I said I was going to add, the really big article. I am going to link it in the description though, so just make sure that you guys look that up, because that is a very, very good article to start on. And then reading that article, that overview of the literature, you can kind of go and check out the citations based off of that. Any of the questions, you can feel free to ask me at Combat Athlete Physio on my Instagram, or CombatAthletePhysio@gmail.com for Gmail. And then I have a Reddit, Combat Sport Injuries. There's been a couple people post there. I've posted a couple of things for injuries there. Feel free to contact me and ask me any questions that you want. And I appreciate it if you've made it this far. I'll see you guys next time, and I appreciate you guys watching.